Hi guys, welcome back to the channel. Let's start today's class. Primary hyperparathyroidism. This is the systemic disease affecting bone. Okay, we have seen fibrodysplasia and cherubism. Now we'll be starting with primary hyperparathyroidism. Clinical presentation and pathogenesis. It is caused by hypersecretion of parathyroid hormone PTH. The main feature is hypercalcemia, which is more than 10.5 mg per dl. Okay, hypercalcemia more than 10.5 mg per dl. Presence of osteolytic defect with giant cell, a condition referred to as brown tumor. Osteolytic defect with giant cell, a condition referred to as brown tumor, but only in 5% of cases. Primary hyperparathyroidism associated with brown tumor, but only in 5% cases. Presence of renal stone, that is nephrocalcinosis, this is also 5% cases, seen in 5% cases. More common in women. Primary hyperparathyroidism is more common in women and older than 50 years. And the more commonly seen in women who are older than 50 years. Most gland hyperplasia is of unknown cause, and some are related to multiple endocrine neoplasia syndrome of familial inheritance, that is MEN1 and MEN2A. That is the hyperplasia which leads to hyperparathyroidism. Mainly the hyperplasia is idiopathic, so it is idiopathic hyperplasia of the gland, but sometimes it is related to MEN1 and MEN2A. What is MEN1 and MEN2A? It is multiple endocrine neoplasia syndrome of familial inheritance. Multiple endocrine neoplasia syndrome of familial inheritance. Okay. Neck mass is usually not palpable and it is asymptomatic. Okay. PTH increases serum calcium level. What does parathyroid hormone do? It increases serum calcium levels. So there is hypercalcemia. How does it increases serum calcium level? It increases serum calcium level by increasing osteoclastic bone resorption, reducing renal excretion of calcium, and increasing calcium absorption in the small intestine by 3 ways. सबसे पहले increasing osteoclastic bone resorption, reducing renal excretion of calcium, and thirdly increasing calcium absorption in the small intestine. A compensatory hypophosphatemia and an alkaline phosphatase level can be elevated in widespread lytic disease. Now, hypercalcemia related signs and symptoms. In hyperparathyroidism, there are three main criteria in which signs and symptoms are related. First is hypercalcemia related signs and symptoms. If there is only hypercalcemia. So what are the signs and symptoms of hypercalcemia? First is thirst, nausea, vomiting, constipation, weight loss, anemia, peptic ulcer disease, and hypertension. These all are hypercalcemia related signs and symptoms seen in primary hyperparathyroidism. If hypercalcemia is severe, that is, it is more than 15 mg per dl or long lasting, there will be confusion, depression, psychosis, fatigability, muscle weakness, and paresthesia. See, there are two things. First, hypercalcemia related signs and symptoms seen in primary hypoparathyroidism. Okay, क्योंकि इसमें हाइपरकैल्सीमिया होता है, हाइपरकैल्सीमिया हुआ है तो उसके क्या साइंस एंड सिम्टम्स होंगे? तो उसके साइंस एंड सिम्टम्स होंगे थर्स्ट, नॉजिया, वॉमिटिंग, कॉन्स्टिपेशन, वेट लॉस, अनीमिया, पेप्टिक अल्सर डिजीज एंड हाइपरटेंशन. लेकिन इफ हाइपरकैल्सीमिया सीवियर मतलब बहुत ज़्यादा है, बहुत ज़्यादा मतलब मोर देन 15 mg per dl, देन द सिम्टम सीन विल बी कन्फ्यूजन, डिप्रेशन, साइकोसिस, फटीगेबिलिटी, मसल वीकनेस एंड पैरेस्थीसिया. Okay, that's all for today class. Next class we'll be dealing with bone related signs and symptoms and urinary tract related signs and symptoms seen in primary hyperparathyroidism. Okay, till then like, share, subscribe and comment. Bye.